another thing that came in that hip kit was this strap that looks kind of like a seat belt.
Okay.
Now the purpose of this is that for people to put it on their feet and help them lift their legs into beds or into chairs. I didn't use it for that. What I used it for was I hooked it on the handle of, I drive a truck, a large pickup truck. And which again, the limited range of motion with my neck or anything, my truck door is way out there. And it was painful for me to grab that and shut it. So I hooked this on my door handle, and then I was able to hang the other little loop on my blinker. So I could get in and just grab a hold of this and pull my door shut.
Welcome to Bed, Back, and Beyond, sharing positive stories of recovery from serious back or neck injury. Your host is CK, a fellow champion who draws on her own experience with herniated disc surgery. Join her as she talks with others who have overcome the physical and emotional trauma of a painful injury, and discover for yourself how you can find hope and encouragement in recovery.
Hi, and welcome to this episode of Bed, Back, and Beyond. Before I introduce our guest, I would like to read some fan mail. So in August, I had somebody write in and say Loretta's story, she was the marathon runner, resonated with me so much. I waited 14 months to finally get surgery, so my nerves were so damaged. I lost bladder control, and now I'm 7 weeks post-op and want it to be already 100%. But this is still going to be a journey for me. So it was confirming to hear her say that it was 6 months or more before she was pain-free. I just have to be patient. The emotional trauma from this has been so difficult. Just appreciate hearing a similar story so much. Thank you so much for your fan mail. I really hope that you're recovering well. I can't respond through the fan mail app, but if you go to my website, bedbackbeyond.com, and click share your story, you can reach me through there, or you can email me at ck@bedbackbeyond.com, and I'll be able to respond to your request. Hi, Mary. Thank you so much for joining me on this episode of Bed, Back, and Beyond. Just so you know, I was so excited to have you on that I put fake eyelashes on. It's not something it's not something I normally do. So if they start falling off during the podcast, let me know.
Okay. You're braver than me. I can't do those.
Okay, they're terrible. So before we dive into your injury, how about you tell us about yourself?
Well, I'm 46 years old. I am a rehab nurse. I've been a nurse for 24 years. I work in a rehab facility. I had actually wanted to be an occupational therapist, but life led me to being a nurse instead. But I was still able to work in the rehab area of healthcare. So I think God puts you where He wants you.
Right.
But that being said, that's a very physically demanding nursing job. There's a lot of lifting, and I think that contributed to my injury.
Mm-hmm.
I also have been very active my whole life. The more, outdoorsy and active things I could be involved in, the better. I've also remodeled a few houses, mostly by myself, and that's a lot of things that are strains on your back. And so there's been a lot of things that I think that probably led up to my injury.
Mm-hmm.
But I think it was actually a really extended car ride that hit me like a bolt of lightning.
Okay.
Really.
So when did you first start noticing some weird pains or however your symptoms started?
About a little over 5 years ago, my oldest daughter bought her first house, and it needed some work. It needed a remodel, and I was happy to help her with that. And one of the things that needed to be done was the floors needed to be refinished.
Ooh,
and wooden floors in there, after ripping carpet out, I sanded them with a palm sander. So I was bent over for a very extended amount of time for several days in a row. And that was the first time that I had a really bad back pain, where I needed her assistance to get up. I had to call her because she wasn't there and say, kiddo, you got to come here and help me stand up. I can't stand up. There's something wrong with my back. And so of course she was happy to, but it recovered relatively fast, I would say within a few days. But that was the first really bad back pain that I experienced. And then here and there, I would have little flare-ups, I guess, or episodes of low back pain that would recover within a few days. But then last summer, my two younger kids who were teenagers and and my longtime boyfriend, we were taking a trip out to Michigan. And we were driving there I live in the middle of Missouri, and it's about a 13-hour drive from here. And so sitting down, I have a really bad habit of not having a good posture when I slouch, bend over kind of. And my oldest daughter was pregnant with my first grandchild, and she wasn't due for a month. And she stayed in Missouri, but we had been in Michigan for about 4 hours after that drive. And she called and said, "What's it like when your water breaks?" I said, "Why are you asking me that?" And so sure enough, she was in labor. We turned around 13 hours back to Missouri. She had her kiddo, no problems whatsoever, but she was early. So she said that they were going to keep her in the hospital for a few days. My other two kids were devastated that they were going to miss out on their vacation. So I made some meals for my oldest daughter, stuck them in her freezer, and said, "Would you be angry if we went back to Michigan?" And she goes, "No, go." She goes, "We're going to be here in the hospital anyway." So 13 hours in the car back to Michigan. Again, it's just slouching, trying to be comfortable in a van that I had rented for the trip. And while we were there, the second trip back, I started having some pretty severe low back pain. And I thought it was just, we were in a really hard bed that in the Airbnb I had rented. And I thought, this is just mattress, it's horrible. But
I have to stop you for a second. I need to stop you for a second. You said you're 46?
Yeah.
Yeah. So I'm 47. And when somebody 46 says, my grandkid, I think, we're not old enough to have grandkids.
Yeah, I know. It's weird. It's weird.
Yes,
she just had her second one. She had two.
My goodness.
Yeah, 13 months apart. So,
well, congratulations.
It's thank you. Oh, it's great. It's the best thing in the world. It's like the love for your kids, but with sprinkles on top. It is just the best thing ever.
So was that what, about 40 hours of straight car ride, basically?
It was a lot. Yeah. Over.
Okay.
So 13 times 4 was that 52.
Okay.
Yeah. This was a lot of time slouched over.
Okay. So you get it out of the car and you notice your back is feeling stiff, or?
I mean, I did notice that, but it was more after we had gone back to Michigan the second time. It was just kind of, it was a sharp low back pain. And I didn't, of course, realize that it was a herniation or the severity of it until it progressed after we got back. And I probably relatively quickly, compared to other people's stories that I've heard you talk about, it was very sharp. And then I started having the sharp pain in my kind of upper buttock area. And I thought, like you did, that it was an SI joint issue then.
Right.
And I got a hold of my primary care provider and told her that I had suspected that, and would she put me on a steroid dose pack. And she did. And the pain let up a little bit after that first round of steroids. But then I would say just a few weeks later, it came back and was getting worse. And again, I'm, lifting on patients at my job and working on these houses. I turned 2 of them into Airbnbs. And so I'm really busy taking care of those. And I had this new grandbaby who, though she was early, she was early, so she was very small, but it was painful for me to even hold her. Under 7 pounds. I mean, just no weight at all was really hurting me. And my pain was, oddly enough, relieved when I was standing and walking. At that point, I didn't have any pain standing or walking, but sitting like I am now, or any position laying down, felt like the knife or the ice pick in my back.
Right.
and it just again was getting progressively worse. And then I started, like I said, it was in my buttock area. It hadn't traveled down my leg.
Right.
And I went to a local chiropractor, which was like the final straw that made it worse. I'd gone to her before. Yeah, I'd gone to her before whenever I had my back issue before, and I think I probably have a bulging disc in my neck too, but I'd had relief with her before. But this time when I went to her, she torqued me exceptionally hard, and immediately I felt like a bolt of lightning down my entire leg.
Oh, wow.
Yeah, and hollered out. It was like, this is not okay. And, walked out of there, and it just got so much worse so fast from there. And I asked my provider for another steroid pack. My best friend is a pharmacist, so I contacted her first, and I said, how dangerous is this that I'm taking these close together? And she said, no, go ahead and ask for another one. And
right.
And then she also said, and by the way, I know another chiropractor that you should go to. And I was like, no, I'm not. No, thank you. And she said, no, this one doesn't do that. She said, this one has different techniques that they use. Well, this one is about an hour and 20 minutes away from my house, but she just raved about him. And so I went ahead and made an appointment with him, and could barely even make the drive there. I mean, the pain was getting so severe so quickly. But he, the first time, had a massive TENS unit that he put, on my back, and did the heat and cold. And he had one of those decompression tables. Right. With the harness they put on your waist and everything. And that did give just a little bit of relief. I have an inversion table here that I had gotten after I hurt my back years ago, and I couldn't even get on it at that point. It was too painful to lay down, like I said, so I couldn't even get on it. But the decompression table that he used was just so slow with the way that it would pull and then let go. And it would give me temporary relief. But by the time I made that, over hour drive back home, the pain was back. Yeah. And meanwhile, I had been contacting my primary care provider is a nurse practitioner, but I had been asking her, is there anything else that you can think of right now that would help? So she ordered me muscle relaxers, and I had a hip injury also years ago, and I had been prescribed meloxicam or Mobic for that. And so I asked her if she could, reorder that for me, represcribe that. And so she did. And is that a pain med or? It's an NSAID. It's an anti-inflammatory. It's same category as like Aleve and ibuprofen. But it's hard on your stomach too. So at that point I was taking, extra strength Tylenol, Aleve, ibuprofen, meloxicam, the muscle relaxer. I was alternating heat and cold just all the time. It got to a point where I was lucky to get about 3 hours of sleep a night, just because it was so painful to lay down. I mean, I just walking was just the only any bit of relief I have, but you can't sleep like that, And so I was just exhausted, and I got to where I couldn't work. I got to where I could barely walk. I was dragging my foot behind me. It was just an incapacitating pain that people could not possibly understand if they haven't been through it.
No, they don't. Yeah. The worst thing I ever experienced in my life was herniating my disc. Yeah. And I don't know that I've ever mentioned it, but I had a pool. And so I would try to float to try and do a little decompression therapy for myself as well. And it didn't
give you any relief.
No.
Well, one of your guests that you had in the past, Jeff, I think his name is, that has a online program to try to help people with herniated disc without surgery. I followed him also, and was trying to take advice from him to try to avoid surgery. And one of his main suggestions was that, and it didn't help me either. It's so scary to think of going into surgery that you just want to exhaust every effort before you get there. But it's just so overwhelming, and it just overshadows everything you try to do in your life.
Did you get referred to a back pain specialist at all, or
Well, so
to
I
try and
asked,
manage the pain?
yeah. So I asked my provider, being in the healthcare industry, kind of like know what needs to happen next. But luckily, one of my coworkers that I'd known for about 20 years she'd had this injury too, and she said, Mary, you advocate for your patients all the time. You've got to advocate for yourself more
It's hard.
aggressively. Yeah, she's like, more aggressively. And
Yeah.
so I got a hold of my primary care provider, and I said, listen, I currently can't work. I'm the only income in my house, so I have got to do something here. Can you please refer me to the pain management clinic and a neurosurgeon, both?
Okay.
And so, and she did. And so at that point, again, I was not sleeping. I was not able to work. I couldn't hold my grandbaby. It was just so miserable. And probably about 2 weeks had gone by, and I hadn't heard anything from either one of those clinics. And now the pain management clinic is within the healthcare system that I work in. And so one of my aunts is actually a nurse practitioner that used to work in that clinic. And so I got a hold of her, and she suggested that I not get the injections. So, because of course that's what they wanted to do. They wanted to do the injections. And and she had not had this same injury, but just in working there, she suggested I not. And I said, why? And so she said, because she said, I see more people have more pain with them than relief. And so she said, if I were you, I would have already had surgery. And so, and so I said, okay, well, thank you. So, and then that same coworker who had told me to advocate for myself, I asked her about it, and because I knew she had had the injections, and then she told me the same thing then. No, don't do it. She said, if you can avoid it, if you can get approved for the surgery without the injections, don't do it, because she was one of those people that it just made her pain even worse.
Right.
And I think it's the pressure in there.
Yes, exactly.
I think it is. Yeah.
I did one injection, and I maybe felt better for 2 weeks, and then it wore off. And now someone I didn't chase this down to see if it's true or not, but somebody told me those cortisone injections have limited returns. So you can only get it so many times before your body just gets used to it. And I thought, at that time I was 40 or 41, and I thought, well, I don't want to use up my cortisone before I hit 80,
Right.
I'll probably need it for other things later.
Right.
And it's like, and I had interviewed somebody on the podcast who had the injection, and the pain from the pressure had him on the floor.
Right.
And he didn't do it.
I think I know who you're talking about. And I watched his interview with you more than once, just because it was giving me hope before I had my surgery, that he was doing so well afterwards.
Yeah.
But so I didn't hound the pain clinic because I had multiple people telling me that, but I went ahead and called the neurosurgeon clinic myself, even though I'd had the referral, and said, look, this is who I am. This is who referred me. This is what's going on. And they, and I haven't heard anything. Can you tell me when can I expect to hear from you or get my name on the books for an appointment for a consult? And they said, oh, well, it says here that you have chronic low back pain with no sciatica. And I said,
what?
No, I said, I have acute on chronic, which means I have chronic, but I have new onset on top of that. And I have debilitating sciatica where I can't walk. And they said,
did you have an MRI yet?
By that point I had. And again, I had to get a hold of my provider and say, I need you to order me this like ASAP. And just getting that done was miserable, because that was a 2-hour drive there, and I couldn't drive.
Oh my goodness.
So my boyfriend had to drive me there. I live out in a very rural area. So he had to drive me there, and just trying to lay on that table, because laying or sitting was so painful for the amount of time that it takes. I was trying to be still and crying, and the poor MRI tech was just, you could just, they're like, I'm so sorry. And I said, it's okay. So which, can I show you my image from my MRI? Because it's kind of unique from the other ones that I've seen.
Yeah, please.
Okay. So when I first got it, I didn't get an image, and in the report that I received, I didn't actually see the image until I went to my neurosurgeon consult. And so the first image that he showed me was this one, and let me find it. So my hernia is not that big.
No, it kind of looks like mine.
But it hooks, where am I going? It hooks down.
It does. I can see that.
Yeah. So it goes out and down. And so though I saw that and I thought that is what is causing all this pain, that little thing.
That's how I felt about mine. I was like, what? This is a joke. It looked like a little thumbprint.
Right. Yeah. And so, and like you've mentioned in your podcast, you see other people and it's like a golf ball in there.
Yeah.
And I was like, that's it. And he said, yeah, but the real reason that you're having all this pain is this. And so in this one, that entire nerve root on that side, the entire thing is being crushed.
Crushed. Yeah, I can see that.
So that nerve root is supposed to be kind of in a U shape. And that entire side was crushed off. So there was never any relief by that point, no matter what position I was in, no matter what medication I had taken. By that point, my provider had ordered me some actual strong pain medicine, which of course I didn't want to take, because prior to this, I didn't take any medicine, nothing, like a vitamin and everything. And that was it. And so at this point I had like a chart about like the different times I should be taking these medicines just to try to function, because you get in a very dark place whenever you're in that kind of pain, and kind of are in a, if I have to live like this for the rest of my life, I don't know how long I want to live, and I wasn't I've never been a depressed person, but it just really, it really takes your life away for a while.
Yes. And it's funny, I can look back, I like threw my back out in April, and then I herniated my disc in June. And so I was in pain for 2 months. I had my surgery in August. So June, July, August. So when I talk about it now, I'm like, that's so fast. But back then it felt like forever.
Yeah.
Like, what's taking so long? Why is nobody helping me?
So when you say you threw it out and then you herniated it, was that 2 different injuries, 2 different incidences?
Yeah. So I had a long history all my life of just throwing my back out, and the muscles, and it would take about 3 weeks for it to go away. So that's nothing new for me. And my dogs pulled me backward in a walk in April, and I slammed my leg back to make sure I didn't fall over. But then I threw my back out. So I had that normal back pain, low back pain. But it didn't go away after 3 weeks, and it started to shift. And it started to move, and then the pain moved to my glute. And I would, so like May, I had to skip a bridal shower for a cousin because I was in so much pain.
Right.
But all that would happen I would stand up from sitting and get the sharpest pain in my glute.
Yeah.
And hold my breath for a couple seconds, and then it would go away.
Yeah.
And then I could walk around just normal. But then it got to the point where I was needing my husband's help to get out of the bed in the morning, because just standing up was so painful. But then one morning in June, he came over, I rolled over, and I got hit with the most agonizing pain. I remembered writhing and trying to, so I think that was, so my guess is maybe I had a bulging disc from April, and then in June it herniated.
Came out. Yeah.
Yeah. And that's when the worst pain started, down the leg.
Yeah. Is that when you went to the emergency room?
Yes.
Oh,
yep.
okay.
He called the ambulance. It took me 2 hours to get from my bedroom to the living room, which was on the same floor.
Right. Yeah.
And I was saying, we were trying to go to a wedding, and I was like, we can get to the wedding. And my husband's saying,
that's not going to happen.
That's not happening, hon. I was like, oh. Yeah. But the emergency room just gave me 3 days of intense prednisone. Didn't give me an MRI. And they said, go see this back pain specialist. So that was a 2-week wait just to get to the back pain specialist.
Okay.
He's the one that ordered the MRI. And then he gave me 5 days of the Microdiscectomy prednisone.
Yeah.
Which was,
now, did you have any relief with the oral steroids at all?
A little bit, but most came with the Microdiscectomy.
Oh, okay. And then it came back, I'm assuming.
It came back. I wasn't able, I never got enough relief to go back to work
Yeah.
I was pretty much just stuck on the couch until I had surgery.
Now, did you happen to notice that your pain was worse at one time of the day versus another?
I didn't, but I do see people on the forums talking about at night their pain gets so much worse. In fact, somebody just emailed me over TikTok to say, "Is this normal?"
Yeah,
So I see it a lot, actually.
I'm a day shift nurse, and so I'm there whenever people are waking up, and I leave at 7 or a little after. So I don't see my patients at night, and I didn't realize that is a pretty common thing. But but that happened to me. The pain, it's like the sun would come down and the pain would go up, and I was like, I feel like a werewolf or something, because it would just get to where every day I was dreading seeing the sunset because the pain would get so much worse.
Yeah.
And again, the medication just didn't do anything. It didn't do anything at all, except I would try to take a whole bunch of the different ones, including sleeping medicine at night, to try to just get even a few hours of sleep. But yeah, it's, I don't know. There's got to be something to the lunar pole, or that's what the Farmer's Almanac is based on, is the lunar cycle. So there's got to be something related to
Maybe.
that.
Yeah.
Yeah.
So when you finally got in to see the neurologist with your MRI, did he say, absolutely, this is a surgery case?
So it was a neurosurgeon that I
Neurosurgeon.
saw. Yeah. So yeah, I went to him, and he said, because of course, there's a whole list of questions that they want to ask if you've done all these other efforts prior to coming to them. And though I hadn't been prescribed physical therapy, because I'm a rehab nurse, I'm friends with a bunch of physical therapists. I had asked them for entire time up to that point, what can I do to try to help this? And so they're telling me, try these exercises. And some of them that are common ones, like the the dead bugs and the bird dogs, whatever. I could barely do them. I could just barely even do them at all. And so I was trying, and it was just so painful to try to do any of them. So I checked yes, that I had done everything except for the injections up to that point. And whenever I went in there, he said, well, you have two options. He said, the way that you're herniated, this is not going to heal on its own. And I think that he just meant because it didn't stick straight out, because it did have that hook going down. He said, we can go ahead and try to give you an injection, but I can tell you right now that your pain will come back, because this hernia is not going to go away on its own. Right. He said, if you would like to do that, you can. He said, you may have pain relief for a day, and you may have pain relief for a couple weeks. He said, but it's not going to be long term with the way that that's herniated. And since that entire nerve root is pinched off. And he said, or the other option is we can get you into surgery. And I'm like, when can we do surgery? Yeah, I mean,
give it to me, please.
Yeah. And so it's crazy as it is. That was the Tuesday before Thanksgiving of last year that my initial consult was. And he said, I happen to have an opening tomorrow because I have a cancellation. He said, yeah, he said, if your insurance will approve you, he said, we can do it tomorrow. And so where the neurosurgeon is like 2.5 hours away. And I said, yes, please, because, you're so miserable at that point. Right. You just want some sort of relief. So they called, my insurance approved me just almost immediately. And he said, all the pre-op things, nothing by mouth after midnight, go get the Hibiclins bathing stuff, do all that. Right. Well, I have animals, and I have a wood furnace, and I still have 2 teenagers at home. So we had to drive all the way home, get stuff prepared for surgery, go all the way, be back at the hospital at like 6 o'clock the next morning. But I was more than happy to do it. And so he got me in the very next day.
That's amazing.
The day before Thanksgiving last year. And I said, prior to him taking me back, I said, just out of curiosity, if you wouldn't have been able to get me in today, when would your next opening be? And he said, in 2 months.
Right.
So I was like,
so
thank you,
Lord.
Yeah.
Oh my goodness. Yeah. Now, you didn't have to deal with people saying, don't get surgery, whatever you do. since you got
Well,
it?
some of my patients, I mean, over the years had back fusions and stuff, and
Mhm.
and so they had said to me over the years, whatever you do, don't ever get back surgery. And I
Yeah.
had a really big fear despite wanting to go ahead and go through with it, because when I was a baby nurse at like 21 years old, one of my first patients was a woman who had had a laminectomy in her neck, and she
Mhm.
was 38 years old, and it very lasting impression on me. It left her paralyzed.
Wow.
Yeah.
Wow.
And so I was terrified,
Yeah.
terrified after all this to go in. But luckily woke up and was one of the lucky people who I woke up and was immediately going, my leg doesn't hurt anymore. You know? So
That's great.
it's euphoria whenever you've been dealing with that pain to wake up
Right.
and your back hurts, of course, because they just cut into
Yeah.
you, but to not have that nerve pain shooting down your leg that is just so unbearable was just such a relief.
So how did you only had 24 hours notice that you're going to get surgery.
Yeah.
How did you get your house prepared, or what did you do in order to be ready for that?
Well, like I said, my kids are luckily older, and so two teenagers at home still. I just kind of told them, hey, they're going to take me in. You know, I need you to take care of the animals, and we have a wood
Mhm.
furnace that has to be filled in the wintertime. I need you to do this. I need you to do this. I'm going to come home. I was supposed to host Thanksgiving for my family that year, and I said, this is not going to happen. So got a hold of the rest of my family, the extended family, and they of course understood because they knew
Sure.
I'd been going through that. And and so my boyfriend and I've been seeing each other for a little over 5 years, and he went
Mhm.
to the store for me and got me stuff that he knew I'd need here. And prior to that, I had gotten some adaptive equipment that was helping me just to deal with life up until that point, because
Okay.
with the way that herniation was hooked down like that, it was affecting my movement, up here too. So I couldn't even move my head up and down because that was putting pressure on
Mhm.
my spine. And so, I mean, I just had to like use my eyeballs to look down. It was very limiting.
Yeah. Were
Up
you
to that.
giving the no bending, lifting, twisting for 6 weeks?
Yeah. Yeah.
Okay.
Yeah.
Mhm. Some
And
doctors are starting to do 3 weeks.
yeah, I think I would be too afraid to sooner than 6 weeks.
Right.
I mean, I feel like I did a little bit, really, really small movements, but
Mhm.
I hear
Yeah.
about people doing physical therapy like right after surgery, and
Yeah.
my neurosurgeon would not prescribe physical therapy, as a matter of fact. And I was like, are you, but I'm a rehab nurse. Like that's what I live with, is people doing therapy after injuries. Are you
Yeah.
sure? I feel so I on my own reached out to my coworkers that were physical therapists and said, I need you to please tell me some other things that I can do to help me, because
Yeah.
they say strengthen your back and your core, but prior to this, I worked out 5 days a week. I mean, and I had a strong core, but I
Mhm.
really think that I'd probably had a bulge, and then just that sitting position for such an extended period of time is what made my disc tissue go out and down like
Yeah.
that.
Yeah. Okay. Not all doctors prescribe physical therapy. And I'm not sure why. I think some of them think it's too dangerous. My physical therapy was such a blessing as far as emotional support,
I'll
getting me
bet. Yeah.
past the fear of moving again,
Yeah.
and just explaining all the different random pains and shocks that would come up and send me into a panic, and they would like
Right.
talk me down. So
Well, I
I
have to tell
advocate.
you, you did. You talked me down a couple
Oh,
times whenever I reached out to you and said,
uh-huh.
is this normal?
Yeah.
Because like the post-surgical inflammation,
Inflammation.
the neurosurgeons are wonderful at what they do, but I feel like they don't give enough information about what happens afterwards.
Right.
Yeah.
Mhm. Yeah, I always think if I had the time, the book, What to Expect When You're Expecting
Yeah.
for
Yeah.
Pregnancy, I think if I had the time, I would write a What to Expect When You're Recovering from Microdiscectomy.
Well, you doing this podcast
Uh-huh.
it's such a blessing to people that are
Oh,
out there going through this,
yeah,
and all
thank
of your
you.
social medias. It really is.
Thank you. Yeah, I'm
Yeah.
just trying to do what I wish I had when I was recovering. Now, you had mentioned that you had some tools that you used during your recovery that made it a
Yeah,
little bit easier for you? Do you want to explain what
absolutely.
those were?
Yeah, so the grabber that everybody you know is familiar with, I still use this. I had made a TikTok that said I don't need this anymore.
I do remember that one.
Yeah, I still use this often. And I've gone through a few of them because I still have some pain to this day, even though it's been a year. It's
Mhm.
like at this moment, it's a 0 out of 10, you know, but
Right.
I still have every day. It seems like I have at least a little bit. And there's sometimes whenever I've been doing too much that
Yes.
I have a flare up, and then
Mhm.
and I just know to listen to my body now.
Right.
You know,
Mhm.
I think prior to the injury, a lot of times it was just like, oh, I'm going to push through this, you know, but now if I have a flare up, I'll use my equipment again and limit my you know, my motion. I kind of
Mhm.
go a couple days with less bending, lifting, and twisting to just not irritate my back if possible.
Mhm.
And I think a big part of what my pain was before is lifting heavy and twisting at the same time.
Yes.
I think that kind of makes like a shredding motion on the disc tissue.
Mhm.
So I definitely avoid that. But that grabber I still use. And one thing that I heard a lot of people talk about is using that to get dressed. And that
Mhm.
thing did not have as strong of a grip as I needed to pull my pants up
Mhm.
or to take my socks off. So
Yeah.
there's a dressing stick that has this hook on one side and this other hook on the other one. This was, I couldn't have gotten dressed by myself without this thing. And it's firm, you know, it's a wooden stick.
Yes.
Also the sock aid. A couple people have talked about that, but
Yes. Now I couldn't figure that out. Were you able to figure that out?
well, yeah, but again, I'm a rehab nurse, so I help my patients with these all the time. So yeah,
I couldn't get it
you
done.
bunch your socks on here. I should have brought
Uh-huh.
a sock in here, and then you throw it on the floor, and you're holding on to these ropes in your hand,
Yes.
and so your sock is all wadded up on the end, and then you slide your foot in here
Uh-huh.
and pull it,
Uh-huh.
and then the sock goes print over your heel, but then you can use that dressing stick to pull it the rest of the way up.
Okay.
Yeah.
Yeah.
So
I would just push the sock off. I couldn't do it. So I forgot, I just gave up on socks for months.
yeah. Well, the little ankle socks were definitely a lot easier. And another thing that I used that all of these things came in a hip kit. It's called a hip
Yes.
kit on Amazon.
Yes.
So
That's why
another
I asked
thing
if
that
it
I
was from your
used,
hip surgery.
yeah,
Yeah.
was so this back scratcher, which is extendable. I taped my razor onto this. So I couldn't, you know, us
So
ladies.
clever.
And there was I looked online specifically for some sort of extendable razor adapter or something. I didn't find
Yes.
any, but this came in that
Uh-huh.
kit, and I thought, this is perfect. I can reach all the way down to my feet with this thing. So I did a little MacGyvering with this and used
That's
some
too funny.
medical tape and just taped my razor on that.
I just wore long dresses and hid
Yeah.
my hairy legs.
I didn't do it often. I only did it when I
Yeah.
had to. But another thing that came in that hip kit was this strap that looks kind of like a seat belt.
Okay.
Now, the purpose of this is that for people to put it on their feet and help them lift their legs into beds or into chairs. I didn't use it for that. What I used it for was I hooked it on the handle of, I drive a truck, a large pickup truck.
Mhm.
And which again, the limited range of motion with my neck or anything, my truck door is way out there. And
Oh,
it was
okay.
painful for me to grab that and shut it. So I hooked this on my door handle, and then I was able to hang the other little loop on my blinker. So
Okay.
I could get in and just grab a hold of this and pull my door shut. And
smart. Look at you.
I didn't have to pull that heavy door or,
Mhm.
you know, turn my neck or anything. So
Mhm.
these other things that come in the kit that are for other purposes, are handy for other things as well.
Okay.
And then the last
So
thing
that's
that I
the
use
hip
that,
replacement kit,
yeah,
right?
yeah,
The
exactly.
Amazon hip replacement surgical kit, or I can't remember what it's called, but I'll put it up on the screen.
Okay, yeah.
Yeah. Yeah.
And then the other thing I used that didn't come in that, but was again very handy because of the no bending and even the no hold, was just a cup in the bathroom.
Mhm.
So I before I went to any of the consults, I just was having a really hard time with oral hygiene. So
Right.
brushing my teeth and
Yeah.
mouthwash and stuff, I was just making such a mess. And then I finally thought, why don't I have to spit from 3 feet
Yeah. Well,
into a cup and then rinse the cup out?
yeah.
So
Yeah.
little, things like this that really
Mhm.
make a difference and make you not have to be in pain for little everyday things
Right.
helped so much.
That's great.
Yeah.
Thank you for sharing.
Yeah.
I did a how to prep for surgery video on YouTube, and I think I did include the rinsing with a cup just to be able to
Yeah.
brush your teeth.
Absolutely. Yeah. Because you don't realize how far away that sink is until you can't bend over.
Yeah.
Oh,
Now-
one more thing that
Yeah.
I don't have here. A walker. So I
Yes.
didn't get a walker, but I wanted to share on here that people who do get one, they can also use it for an assistive device for their toilet. So if they don't want to get a toilet riser or handles, they can use their walker and put it right over facing the wall, the toilet, and then
Yeah.
turn around and sit down and then use
Yeah.
the walker to stand up.
Yeah, so helpful.
Yeah. And I got a
I
bidet
had-
too. So that was wonderful.
Yes.
Yeah.
The bidet is like number 4 or number 3 on most recommended product.
Yep. Well, that was thanks to you. Watching your videos is why I got that.
It's a little awkward at first, the first time you use it. You have to get used to
Yeah. But then you get used to it and you want all the toilets to have it.
Right, exactly. Everyone says once you go there, you don't go back.
Absolutely. Yeah,
Yeah.
I agree.
Now, how about how did you do with like ups and downs and pains post surgery? Did you have any moments where you were like, did I reherniate? What is this pain?
Well, so listening to you and some other people, I did have an idea that there was going to be, a potential flare up afterwards.
Yeah.
And I was kind of expecting the 2-week mark, but mine came a lot sooner than that. And of course it terrified me. And
Yeah.
I think when you've lived in that pain for a while, you panic
Mhm.
whenever you have any of that return pain, because my return sciatic pain, it was gone initially after the surgery. And then when it came back, it was it at least as bad, if not a little worse.
Mhm.
And it was just like a bolt of lightning shooting down the leg,
Yeah.
every single time that I would stand up. And at that point, I had to sleep in my recliner for a while
Mhm.
after surgery. It was hard to get up, but once I got up, that pain would shoot down my leg and it would almost bring me to the floor. It was so bad.
Yeah.
And I thought, that's it. I reherniated.
Mhm.
I'm going to have to do this again. But it eventually eased up a little bit. I did ask for another steroid dose pack,
Mhm.
and that made it less, but it didn't make it go away completely.
Mhm.
And I continued to take the pain medicine that they had prescribed after surgery, and it was giving me relief, as opposed to prior to surgery when I was not getting any relief. And so I thought, okay, that's got to be a good sign.
Mhm.
And another thing, like with that moment and since then, when I have flare-ups that scare me, is like, I don't know about you, but for me, coughing or sneezing or even clearing my throat, any kind of internal pressure, you could feel it in that nerve down your leg or your lower back. Did you have
Yeah.
that?
Mhm.
So now if I get a little bit scared, I'll do that. I'll cough or do something to see if I feel any of that pain. And I don't,
Yeah.
but that's kind
Yeah.
of like a reassurance. Okay, it's just a flare up. It's
Right.
not pushing on my nerve. It's just a
Yeah.
little bit of anger back there in the back.
Sometimes some of my flare-ups come around my cramps. When I have really bad,
The hormones,
yeah,
the hormonal stuff. Yeah.
cramps. I can feel the cramps I feel like I have pain in my surgical site. And this is like 6 years
Really?
later. Yeah. I'm like, my
Wow.
scar hurts. I'll say to my husband,
Right.
but when they're particularly bad, it'll cause a flare down my legs.
Wow.
And that took some getting used to. Like, oh,
Yeah.
it's just your period's coming. Like,
Right. Yeah.
yeah.
What about weather? Do you have any pain?
I haven't
with weather
noticed
change?
weather. Mm-mm.
No.
No. But when I have a really hard day at work, where I don't get a chance to sit down much, or I'm on my feet all day, my back will still to this day like tighten up like it did
Mhm.
during the herniated disc. And my husband will
Yeah.
say, it feels like you have 2 rods. And so I'll just use a really good heating pad.
Oh,
And
he can
relax.
even feel it?
Yes.
He can feel it
He
externally?
can,
Wow.
he can feel my back. And as soon as the back tightens up, it sends a flare down my leg. But
Gotcha.
yeah, just use a really good heating pad and take some Advil or whatever and
Right.
relax for a day. And it usually goes
Right.
away within 24 hours.
Good, yeah.
Mhm.
Now, did you have any like odd sensations for a while after your surgery that you didn't have before? Because I felt like when I went back to work, I kept feeling like suddenly there was cold water on my leg, and I'd never had that before.
No.
No,
My numbness never went away. Like my leg is still. So, and I can
Wow.
only really notice it when I'm shaving. You can feel the difference.
Okay, yeah.
It's tingling, but my nerve is still a little bit compressed still because there's a chunk of disc
Yeah.
material stuck on my nerve. But yeah, so that never went away. But I never got the cold water sensation. I have heard people say like, I
Have
feel like
you?
my leg's in ice. Yeah.
Yeah, it's weird. Yeah.
The nerves do all kinds of weird things when they're
Ooh.
regenerating.
Don't they? Yeah.
Yeah.
It's like the whole inside of your body is just kind of freaking out after you did that.
Yeah. I really got just surprised by the muscle spasms. Like I knew muscle spasms would happen. They had given me a prescription for muscle relaxers. But I remember the first time it came, I was just laying down on the couch and all of a sudden I got this spasm and I almost like jumped in the air.
Wow.
Yeah. I was like, oh my gosh. And that lasted for a couple of days.
Did you take those muscle relaxers before surgery at all?
No.
No.
No, I never got muscle relaxers. I never got gabapentin or anything like that. Just steroids and Tylenol.
I actually asked my provider for either gabapentin or Lyrica. That's the other medication that's similar to gabapentin. And she didn't prescribe it for me. She said, I really would rather you not take that. There are just a lot of bad side effects, and I don't want you to start on that and have a hard time getting off of it.
Yeah.
And another girl that I had followed on TikTok and Instagram that had the same surgery, they had put her on gabapentin, and she's around our age too, and she had a horrible time getting off of it. So I'm
memory loss. The
grateful
girl with the memory loss.
Huh?
Is that the girl that has the memory loss on the gabapentin?
No, she had like almost withdrawal symptoms. She was, her name is Amberly. She's a flight nurse. Did you happen to see any
I don't
of her
think I've
on
seen
TikTok?
hers.
Yeah, she had a full recovery. She actually had surgery, I think, 2 weeks prior to me. So I reached out to her and talked to her. And again, she's a nurse that does a lot of heavy lifting. And I had asked her, are you going to go back to your job? And she said, yeah, I have to. And which also, when I first had my surgery, my neurosurgeon said that I was going to have a 30-pound lifting restriction for life. And I said, well, I can't do my job like that. I take care of adults that clearly weigh more than 30 pounds. And so, so then I was just devastated because I love my job. And so I reached out to my boss and I told her what was going on. And, you know, of course she didn't want me to go because I worked there for so long. I'm a shift manager on the weekends on the unit I work on. And, so I went ahead and applied for a clinic nursing position and told her I didn't guess I had a choice. And so I was hired on there, and I started to go in for orientation, and then I had another follow-up, and I hated it, by the way. I am not a clinic nurse at all. I then had another follow-up with my neurosurgeon, and he lifted my restrictions, and I was like, oh. And so I got a hold of my old director, and I said, did you fill my position? Can I have my old job back? And she's like, yes, come back, please.
Oh, great.
Yeah.
So you're back to lifting patients.
Yeah. So I was able to come back, but for a while when I first came back, I still had, you know, pain, and luckily my coworkers were great, and they would try to do the lifting if they could for me, you know, like I would be their last resort to lift on people. And so, but even like opening doors or, you know, just little things that you don't think would hurt your back or put pressure on your back, just scooching a chair out for somebody. I mean, just the littlest things at first, right after surgery. Well, I say right after, but 12 weeks, 12 weeks after surgery, there was still pain definitely in there. And it was scary to go back to that position, but it's great now. Yeah. I don't have any pain doing any of that. I'm just more cautious now.
Yes.
Yeah.
It took me 6 months to get to pain-free.
Yeah.
And there's twice after my surgery that I asked for an MRI because I swore I had reherniated.
So scared.
Yeah. 2 different times my pain hit me so bad.
So
and
did you get them? Did you get an
I got
MRI?
2 MRIs and
Wow.
I got MRIs both times and it was normal. It was just
now,
painful.
did you still have evidence of the hernia in your MRI? Because I've seen people that have had repeat ones done and after surgery, and it doesn't look like they had any relief, but like they can still see the hernia there, but I guess it's off of their nerve root.
Yes. So when you look at my MRI, you can still see the chunk of disc material that's stuck to my nerve. Yeah. But you can see like there's a line of demarcation, so you can tell that it's separate from the disc.
Okay.
Yeah.
Did they say you had a laminectomy also, right?
Yes. Mm-hmm.
So did they say they left like a bigger window over that?
Yes.
Okay. For the pressure.
For freedom of movement. So the nerve moves more. Yeah. So
I wonder, I never asked this. I don't know if you did, if that bone like grows a little bit or scar tissue into the window that they leave there.
I don't know. I never asked. I didn't ask.
I didn't either.
I don't feel like I said the numbness never went away, but my pain never returned. So I'm assuming that the movement is still there.
Right.
So I'm guessing no. Maybe if Lady Spine Doc ever sees one of my podcasts, she can answer.
I follow her too. Yeah. Oh, also, she does the barricade. Did you ask about that?
No. Does she do barricade? Yeah.
She does. Yeah. So I had asked my neurosurgeon, would he do a barricade to, try to prevent reherniation, and he doesn't do them. So
I would do it. Yeah. I think there's some risk of it is, and I do think there's some risk of maybe rejection or allergic reaction or something like that. But I would love to have a barricade patient come on and tell their story. And now even the disc, instead of fusions, they do a total disc replacement.
Yeah.
So that just seems a lot better than a fusion in my opinion. But who am I?
I think they have to go in from the front to do that though. I think so. Yeah.
Yeah.
Because actually I have a coworker that did have a disc replacement in her neck. And they had to go in the front for her, but I can't imagine them going, through all of your organs in the front for your.
Well, for some spinal fusions, they have to go through the front.
Do they?
Yeah. It depends on location and all that.
Right. Yeah.
Yeah. What else did I want to ask you, Mary?
Did your surgeon tell you that there was like a potential limit on how long your surgery would be good for or anything? I just had a patient this weekend who had a fusion, but she had a prior an open discectomy. And again, she was an older lady, but she said that her surgeon years ago, whenever she had hers done, had told her that hers would probably only last 5 years, and then she would have to go back in and get a fusion. But she said hers lasted 15 years.
Yeah.
And then she started having the pain again, and then she went and got a fusion. But again, that was a long time ago. I'm hoping and praying that our less invasive surgeries are more long-lasting.
I see that a lot. Some of the people will get on line and say, don't get a discectomy because it just guarantees you a fusion down the line. Right. And that's not 100%. Especially if your herniation was due to injury. Some herniations are just due to poor spine health. Right. And in my, like I said, who am I? Nobody opinion, that if you have poor spine health and you have vertebrae that are shifting, then I feel like you're most likely going to be someone who needs a fusion. There's all those different spine conditions, but hopefully you and I continue going wonderfully.
Fingers crossed. Right. One of the providers that I worked with on the rehab unit has had multiple back surgeries, and he has had to have multiple fusions. So I think that avoiding a fusion, if at all possible, is recommended, because then people tend to get adjacent disc syndrome.
Right.
And then they have to go back in and get the next level fused and the
Right.
next level fused.
Yes.
And this provider is evidence of that. So over the years we've worked together, I've seen
Yeah.
him have to go back multiple times to get more levels fused.
Yeah, I have seen that.
Yeah.
Yeah. So if you knew somebody who was saying, "Oh, do I get this back surgery or not?" What were any things you would like them to hear from you or from your experience?
I had a great surgery outcome, but I think that people should, as painful as it is and as frustrating as it is, I do think that people should jump through the hoops and exhaust the other efforts, because I do know a few people who have been able to avoid surgery and are living pain free with just the more conservative measures, you know.
Yes.
So I think if people are able to avoid it, that they should. But I the imaging is definitely a confirmation of what's going on back there. But then you also hear of people who have herniated discs and they didn't even know it until, you know,
Right. Yeah.
on multiple levels, and they're not even having symptoms at the other levels. So I mean, I do think that if you're having pain that's limiting your life and your ability to work and, you know, hold your grandbaby or do anything that would be your normal, you know, activities of daily living, that people should definitely advocate to get the imaging for a confirmation of what's going on, and then push to keep making things happen. Because you know, I just feel like if you don't speak up, then the doctors or providers think, oh well, they're fine, you know.
Yes.
The squeaky wheel gets the oil, unfortunately. And if you don't squeak, then they think you're fine. So if people are still living in pain, then they still have to say, this isn't working, we need to do something else. And even if they have a consult, you know, if the specialist is not reaching out to them, call their office and say, hey, what's the game plan here? Because I can't live like this. But yeah, I think that surgery is definitely something that gives a lot of us our life back whenever it's been taken away from this pain. And as scary as it is, it's scarier to think of living years like that.
In pain. Right.
Yeah. Yeah.
Mary, I really appreciate you taking the time out of your day to just come on Bed Back and Beyond and share your story. Really
thank
appreciate
you so much for having me. I felt like I've met you already, because I just watched all of your videos and social medias over again. I refer you to everybody that says that they're having back issues. I'm like, listen, this lady and her stories had got me through my whole ordeal. You got to go watch her and listen to her advice.
I appreciate it. I appreciate your referrals and saying such nice things. I really appreciate it.
It truly has. And thank you for doing what you're doing. I really appreciate it.
Thank you. If you are a person who has a positive story of recovery from a herniated disc or back surgery and you'd like to share your story on the podcast, head over to bedbackbeyond.com and click share your story. I'd love to hear your voice on the show. Mary, once again, thank you.
Thank you.